All right, everyone. Hi, and welcome to our live session today. I will be going over a quick startup presentation to welcome you all and introduce you to our program and various opportunities if you have not previously attended our shadowing sessions. We are Pre-Health Shadowing, and we are a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare students and professionals gain access to educational resources, no matter their demographic status, abilities, or location. My name is Emma. I am a part of the social media and marketing team at PHS, and I thank you all for attending today. Just a PSA before we start, we do have closed captioning for all of our sessions to accommodate all students. This setting is available on the bottom of your Zoom screen, and if you need assistance enabling the transcript, please direct message me or one of our team members. We are always looking for ways to be more inclusive and ensure our sessions are accessible to everyone. So please, if you have recommendations for how we can improve, you can email us at info@prehealthshadowing.com. If you want to stay in the loop and keep up with any new sessions we might have or any other events we're hosting, follow us on social media. We are active on Instagram and TikTok, or you can sign up for our email list on our website to never miss a session. Since this is an international program, we want to know, where are you Zooming in from today? Drop it in the chat. I'm currently calling from Atlanta, Georgia, United States. Okay, I feel like I'm seeing every state in the US. We've probably hit every region. That's exciting. I see someone else from Atlanta, Georgia. Hello. Okay, cool. Nice to meet you all. Okay, so we have some wonderful opportunities for you all as benefits of being a part of PHS. If you're looking to get research experience, or if you dropped the ball on applications this year, we are launching a research program that will allow students to connect with PIs or principal investigators as they conduct research in a plethora of topics, fields, and locations. This program is 100% remote, which means you have the flexibility and power to connect with anyone. The subsets of this research in this program includes diversity, medical education, student interest, health professional school matriculation, and mental and behavioral health. Students will have access to professional connections through seminars, which are one-on-one meetings, and have undergraduate mentors assist them with their projects. With that said, we are also offering the opportunity for students to become mentors in this research program. Applicants are strongly encouraged to possess the following strengths: data entry, data analysis, academic writing, collaborating with students, presenting data or concepts, and more. If you're interested in the research program or in becoming a mentor, please scan the QR code on the screen and apply. For the past few months, PHS has been hosting a bingo board social media event where you will be able to fill up a bingo board with each board having a specified dollar amount. To participate, all you need to do is post this on your social media platforms and get a group of friends to help you fill up the board. Check out our blog post for more details. We've also partnered with Krispy Kreme for you to purchase 1 dozen donuts to enjoy with your loved ones. With a donation of $10 or more, you'll be able to receive your treat while also helping us at PHS. More information and instructions can be found by clicking the link sent in the chat. It's a great time to exercise outdoors with PHS's new Pledge Drive event. For this event, you will essentially be able to work out and help raise money for an excellent and healthy cause. For every $5 donated to you, you'll be required to exercise for 1 hour. For more information, please visit our website underneath the blog section. Mask for Mask is an amazing women-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic, those in the homeless community, healthcare workers without proper PPE, and others who are struggling to stay safe. With our discount code PHS15, you can get 15% off your order. If you buy through this method, pre-health shadowing will also get 10% of the proceeds, which is an amazing because we are currently a nonprofit that runs solely off of the support of our community. And if you'd like to play a bigger part in PHS, we would love for you to join our network of student volunteers and team members. You can apply to be a part of our administrative team and lead students in various projects and initiatives with professional outreach, grant writing, and more. We understand that as a pre-health student, you may not have all the time, so we offer the opportunity to volunteer asynchronously with tasks that can be done on your own time and schedule. We would love to have you be a part of this program and contribute your own unique perspective to PHS. Along the lines of that, PHS is taking great pleasure to announce the newly available PHS leadership positions for the 2021-2022 academic year. Our organization welcomes students of all majors, education levels, demographics, and professional interests who are eager to make a difference in the field of medicine. Students can take on leadership roles remotely and apply to any of the following positions listed on the screen. As a student-led organization, members of our team take on various roles that encompass project management, volunteer coordination, and collaboration amongst fellow students. Additionally, each of these chief positions will be accompanied by possible assistant chiefs. Lastly, keep in mind that students are given the flexibility to create their own schedules. However, members are expected to commit a minimum of 5 to 8 hours on a weekly basis. So if you want to gain experience in leadership and further your skills, please click on the link sent in the chat. If you have any questions, feel free to message one of our board members and we will assist you. And if you're still a high school student, but you want to get involved, we have started a program called HTP, High School Outreach, High School Training for PHS, which allows you to connect with college pre-health programs and get involved in fundraising for PHS and organize resources for other high school students interested in medicine through pre-health shadowing. We want to recognize all of the hard work from our students in the program. So if you are interested in getting published, you can submit essays, reflections, research papers, and reviews to our editor-in-chief through the link dropped in the chat to have your work published on our website. This will also look great on CVs, applications, and resumes, so take advantage of this opportunity. Part of our mission at PHS is to promote diversity, and in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include a series on patient experiences, a COVID-19 roundtable, and international student forum. If you have a mentor, professor, or professional that has inspired you and you think could contribute to these conversations, nominate them today using the link in the chat. If you can, we humbly ask that you donate to our program. As you know, PHS is a completely student-run nonprofit, and we are working around the clock to keep this free and accessible to everyone. Unfortunately, Zoom and our website are not free, so any contribution you can give would be greatly appreciated. If you're not financially able, we hope you can send this link to someone you think can, so we can continue to support those who cannot afford similar opportunities. And throughout our session today, we encourage you to drop any questions you have for the speaker in the chat. Our team members will be making note of these to be asked in the latter half of the session. Also, make sure to take good notes as our professional is going over their presentation, as there will be a chance to take a post-shadowing quiz assessment to verify your virtual shadowing hours. More information will be available on the end of this session, so stay tuned. Lastly, if you can, we request that you turn your cameras on. This is by no means an obligation, as we are respectful of different circumstances, but it does help us feel closer in a time where socially distancing is our norm. We also request that you make sure to mute yourself, as this will ensure the professional has the complete and full attention from the audience. I appreciate all of you for listening, and now I would like to welcome our professional today. And let me just stop sharing my screen. And you're ready to share whenever.
All right, sounds good. Thank you, Emma, for that lovely introduction and educating us all about the wonderful things and how we can give back. All right, everyone, thank you so much for joining me tonight. Tonight, we're going to talk about the basics of telemedicine. My name is Hina Mazharuddin, and I am a PA. So we'll start off tonight by, I'll talk a little bit about me so you get to know a little bit. We'll start off by defining what is telemedicine. We'll go over the different types of telemedicine, and I'll give you some case examples as we go through it. We have some high profile patients for tonight, so I hope that it will keep your interest. And then I have a bonus interactive case for you, and then we'll end with a Q&A. All right. And so a little bit about me. I have been a practicing PA now for 13 years. And I've been practicing virtually since 2018, so pre-pandemic. My full-time job is I practice obesity medicine here in Dallas, Texas, and I utilize telemedicine in my practice. So that is the way that you typically may think of how somebody utilizes telemedicine. So basically, the patient is at home, I'm in the clinic, we connect over a live two-way audiovisual synchronous connection, something like this, and we go ahead and work together to take care of our patient. That is my full-time job. My part-time job is I actually work in a virtual urgent care. So that one's a little bit different because it is a kiosk that is located inside of a grocery store. So the way that works is basically, like I said, there's this kiosk. A patient would walk in, there is a medical assistant there. The medical assistant would go ahead and greet the patient and get the patient set up. Then they would call me. I hop onto a platform, again, similar to this, and together we take care of our patient. At the kiosk, I have access to all my regular tools. So things like your otoscope, ophthalmoscope, stethoscope, except all of my tools now have a camera attached to them. So I can look inside ears, nose, and throat and listen to heart and lungs. We can also utilize things like remote patient monitoring and artificial intelligence to better take care of our patient. That is my part-time passion. I am also the vice president for PAs in Virtual Medicine and Telemedicine. That's what PAVMT stands for. And in that capacity or role, I get the privilege to lead our education pillar. So I get a chance to interact with PA students nationwide and discuss telemedicine with them. I create content that gets integrated into the PA education system to educate about telemedicine. So I joke and tell people I am a content creator, but it's for a very specific audience. And then I put our Instagram handle there in case you want to follow us. All right, so fun facts about me. I enjoy singing. I'm not really that good at it, but it's just something fun, and it's a fun hobby that I kind of get to do. And something that was really fun that I got a chance to collaborate with was with a special interest group, and we did this song called It's Vaccination Day. And it is a medical parody off of the movie Frozen. So it was more impressive was that this was 80 PAs nationwide who came together and just kind of collaborated together to make this song into a reality. And it was a really fun way during, especially the beginning and the peak of the COVID-19 pandemic, for us to kind of connect and have some fun. I also sang at our PA talent show, and that was another kind of fun thing that ended up being a fundraiser. So it ended up giving back to our PA community, and then also the proceeds went to another charitable organization. So I also do medical photography, and I use that word very loosely because I have no real photography skills, but rather what I do is I take pictures on medical things and I post them onto a website. And the reason I do that is it has more to do with, that's my little way of giving back to the community. Because oftentimes in our medical communities, when we are trying to give a presentation, it's really hard to find images that are royalty-free and copyright-free. So that's why I do that, to help kind of give back. And you'll get a chance to see some of the images in tonight's presentation. All right, so here's my non-disclosure statement. Basically, I don't get paid for this. This is just something, my fun way of connecting with you guys and hopefully educating you a little bit more about telemedicine. All right, so here is our first poll question. And I think we're gonna actually do this in the chat. So if you wanna go ahead and tell me, do you think that as a future medical provider, you will be using telemedicine or telehealth? And then let me see if I can actually see some of your chat. Okay. So a lot of people think yes, or they hope so. Very good. Awesome. All right, so now let's move on to the next poll question. What exactly do you think telemedicine is? And this is kind of like a free text thing. So go ahead and type and tell me, if you had to define telemedicine, what do you think that would be? Very good. I like these results that I'm seeing here. Providing medical care attention online or via a video call. Excellent. Diagnosing and treating patients virtually. Virtual care for patients. Excellent. providing care remotely utilizing a video call, an online form for providing healthcare. Excellent. People using technology or online tools to help people. Great job, guys. I'm really impressed. I gave you some possible ideas, but you guys, I liked your answers a lot better than the ones I put up here. So good job on that. And then let's go ahead and actually start defining what is telemedicine. That'll segue us right into our presentation tonight. Let me minimize that here. All right, so what is telemedicine versus telehealth? And it kind of really depends on who you ask. But telehealth is actually an umbrella term, and it involves both the clinical services and the non-clinical services, whereas telemedicine technically is the delivery of clinical care. So let's start by defining what is telehealth. So if we were to look this up from the state of California, they define it as the mode of delivering healthcare services and public health via information and communication technologies to facilitate the diagnosis, consultation, treatment, education, care management, and self-management of a patient's healthcare while the patient is at an originating site and a healthcare provider is at a distant site. Okay, that was a lot of words. The Health Resources and Services Administration defines telemedicine as the use of electronic information and telecommunication technologies to support and promote long-distance clinical care, healthcare, patient and professional health-related education, public health, and health administration. Okay, that still sounds a bit confusing. And the American Telemedicine Association defines it as technology-enabled healthcare and management and delivery systems that extend capacity and access. Okay, so what exactly is telemedicine? It's a platform. That's all it is. So let me kind of go over. These are actually the different types of telemedicine, which we're going to talk about tonight. And we're going to use the definition that has been created by CMS, which of course is Centers for Medicare and Medicaid Services. And the reason we want to look at them as our guidance as far as what they're defining is because they are a federal entity that set the standard pretty much for everybody else. So even your private payers or your state insurances are going to look at them for guidance to get information. So we're going to use them as our definition, or what they're going to set as our definition for tonight. So starting off with the first one up at the top, which is video visits, also known as telehealth. And these are all things that are reimbursable. So rule number one about video visits is that you must be licensed in the state where the patient is located. So I shared with you earlier 2 scenarios of how I use telemedicine. So one is in my obesity medicine practice where I am physically in Dallas, Texas. My patients are usually in Dallas too, or in the surrounding areas. So both of us are here in Texas. I hold a Texas license, so therefore I can see my patient virtually. The second one I told you about is I work in a virtual urgent care. So I am physically in Dallas, Texas. My patients are actually in Delaware. So we are many states away, but I also hold a Delaware license. So that is how I'm able to be physically in one place, but see patients in the other, because you must be licensed in the state where the patient is located. Now, obviously it is the COVID-19 pandemic, so there are some waivers that have been put into place. So it makes it a little bit more lenient, but for tonight, we'll just go ahead and keep with the original definition of to be licensed where the patient is located. All right, so we are going to see a patient together tonight, and we have here Mr. Santiago Claus, but you can call him Santi. He lives here on 1234 Make Believe Lane here in Dallas, Texas, with the chief complaint of burning in my chest. So there are different ways when we do a history of how we can remember certain parts and questions that we want to ask. So there are many mnemonics out there. One is old cards, another one is OPQRST, there's another one called locates, another one called Coldera. They're all essentially the same, but it's a little mnemonic to help us remember what kind of questions we want to ask when we're taking a history. Because telemedicine, remember, is a platform. The medicine doesn't change. It is just the way that we're utilizing to connect with our patient. So these are the questions that we're going to ask Santi here, and we're going to ask him, when did this start? And he goes and tells us a few hours ago, but it's been ongoing for about the past 3 months, but it's getting worse. Location, he describes it as a lump in his throat. Duration has been going on for a couple of hours. He characterizes it as a burning in the chest. Some aggravating factors are certain foods make it worse, as well as laying down makes it worse. Relieving factors are sitting up, and timing is that it's often worse in the evening. On a scale of 1 to 10, he rates it as a 3 out of 10. So keep that in mind, and we'll come back to that visit in just a minute here, but let me just define what is a video visit, which is it must be a two-way live audio-visual synchronous connection. So basically kind of like what we're doing right now. So who can bill for these reimbursements with these video visits? Basically your doctors, your PAs, NPs, midwives, your clinical nurse specialist, clinical psychologist, clinical social workers, registered dietitians, nutritional professionals. And who's covered by this? So some telehealth services can be covered only if you already have a previously established relationship. So originally it was that it couldn't be a new patient. And then where does the patient and where does the provider have to be? So there were originally some geographic restrictions. So you remember in that first definition I shared with you from the state of California, you may recognize that they talked about these words, an originating site and a distant site. An originating site is where the patient is, a distant site is where the provider is. But now because of the COVID-19 pandemic, there has been a waiver put in place, which actually opens up and allows even other professionals to go ahead and utilize telemedicine and get reimbursed for it. So people like who are doing PT, OT, speech therapy, they went ahead and removed that restriction of it had to be an established patient. So now we can see new patients utilizing telemedicine, and all geographic restrictions have now been waived. So previously it had to be that a patient was at a particular site and the provider was at a particular site, known as the originating site and the distant site. But now the patient can be at home and the provider can also be in the clinic, at their home, wherever it is. It doesn't have to be as limited as what it was before. So going back to our patient Santi, so Mr. Santa Claus is a 55-year-old male patient who presents today via a two-way audiovisual telemedicine encounter, complaining of a lump in the throat, burning in the chest, that's postprandial, which means after he eats, after 3 months. Patient describes the pain as a retrosternal burning that lasts a few hours. It's worse in the evening. It's exacerbated by food, such as alcohol, whole milk, chocolate, spicy foods, and is positional. So it's worse when the patient tries to lay down. He reports he often falls asleep in his recliner to help with the symptoms and avoid that bitter taste in the mouth. He's tried over-the-counter Tums, which helps temporarily, and the patient admits to social alcohol and tobacco use, smoking of the pipe, and an occasional cough. He denies any chest pain, shortness of breath, headache, vision changes, changes in bowel or bladder habits, and called in today because symptoms are getting worse during this holiday season. Alrighty. All right, so let's see what our write-up would look like. So our physical exam, which we can still do on an audiovisual platform like this, is we can ask the patient if they have any tools at home and we can get information. So if they have a blood pressure cuff, we can still go ahead and get that information. We can ask the patient to find their pulse and we can count out their pulse. We can even ask if they have an O2 monitor, so like a pulse oximeter. Nowadays, especially with the COVID pandemic, a lot of patients even have these kind of tools at home. Many patients at minimum have a thermometer at home, so we can even utilize something like that. And they can report their height and weight, and many people will also have a scale. So we go ahead and start with our general inspection. We notice that he's AAO times 3, which means alert and oriented times 3. And we notice that he's having some frequent belching. We can go ahead and examine his skin. We can see that he's grossly dry, and that means there's no oozy, pussy, drainy, nothing crazy that we can see, no lesions. Ears, nose, and throat, he can manage his own secretions. EON means extraocular movements are intact. He's moving his eyes the way that we expect, and oropharynx is clear. Respirations are non-labored breathing, no respiratory distress, and is able to speak in full sentences without difficulty. For cardiovascular exam, we can notice if he has JVD, which is jugular venous distension. That often will let us know if the patient is fluid overloaded, if he's having any problems. Sometimes you'll see it, for example, in patients who have congestive heart failure. No edema or varicosity is noted, which basically no swelling or anything like that. His abdomen, we can go ahead and ask him to show us that, and we can, assess that it's non-tender, non-distended. That's what that means. No pain noted with patient palpation, meaning when he pushes on the stomach, we're not noticing any pain. Musculoskeletal, he can move all 4 limbs appropriately. Full active range of motion, that's what FROM means, and his gait was normal. Neuro means no aphasia, no facial asymmetry. We can test for all cranial nerves, including cranial nerve 1, and we can see that they're grossly intact. And an MMSE is a mini mental status exam, and it lets us know that that was within normal limits and he's responding appropriately. For psychiatric, he's cooperative and appropriate in a situational mood. So you've noticed throughout this entire presentation, this entire physical exam, all of this stuff was something that we could just observe. Now we can ask the patient to help us and to gather some information, especially things like the vitals or during certain things that we want to do during a physical exam. But you'll notice most of the stuff was all done by just observing and just by visualization. So what do you think the diagnosis is? And feel free, you can put it in the chat box if you'd like. Good job. Yes, excellent job, guys. All right, so the correct answer is GERD, which is gastroesophageal reflux disease. And remember, that is when the one-way valve between your esophagus and the stomach is weakened. And it sometimes allows for, of course, food, acid, or bile or reflux into your esophagus, and that can cause that inflammation and irritation. So you can have those symptoms of heartburn, regurgitation of sour food, difficulty swallowing, sensation of lump in the throat, and chest pain. So that was what our patient came in complaining of, and we were able to go ahead and come up with a diagnosis and do a physical exam, all using a telemedicine platform. So then the next thing we want to do is come up with an assessment and plan. So we went ahead and did the diagnosis, or you all came up with the diagnosis of GERD, so that was excellent. And we can tell them to try an over-the-counter antacid, like an omeprazole, and we can tell them to follow the dosing instructions on the box. We can talk to him more about some dietary and lifestyle modifications and to avoid foods that can make the symptoms worse. So things like avoiding alcohol or spicy foods or chocolates may help reduce the symptoms. We also encouraged him to keep a food diary and to avoid late night eating. We can also advise him to elevate the head of the bed so that it helps keep the food down and avoids the reflux symptoms. And of course, tobacco cessation was advised. We can follow up with our patient in about 1 or 2 weeks or sooner if needed. We always want to go over red flags with our patient, whether they're in person or on a telemedicine platform, but especially on a telemedicine platform. We want to make sure that we always go over, hey, this is what you should look out for, that if symptoms are not improving or getting worse, we need you to follow up or to seek higher level care. So we make sure that we notate that in our documentation. And due to his elevated BMI, which is body mass index, we advised him to follow up to see a specialist. And we're going to request for something known as an interprofessional consult with an obesity medicine specialist, which happens to be what I do. So we'll talk a little bit more about that and we'll send for that consult. So similarities and differences between an in-person versus a telemedicine. So similarities, as you saw, we could take the same history, we do the same physical exam, we come up with the same differential diagnosis and we narrow it down to our final diagnosis, and then come up with an appropriate treatment and plan. And we'd actually bill for this similar to as we would as an in-person visit. Now you do have to add a modifier, but that's about the only thing when it comes to billing and coding. Actually, I take that back. There are other little things that you can also do, but it's very similar to as if you would an in-person. So you still put the same E&M code that you would. The difference is that obviously you're not there in person. You can't physically touch the patient or do a physical exam. And in this scenario, and billing is actually usually time-based. So sometimes that ends up being a little bit different because oftentimes in the clinic, we do it complexity-based, but in telemedicine, you often do it time-based. So there are little differences, little nuances. So remember I shared with you that I work in a virtual urgent care? This is what it looks like. So you see it's kind of like a kiosk, and you can see that we have all kinds of fun tools over there. And this is kind of what it looks like. So you see our MA over there along with the patient, and she would go ahead and get the patient set up and then call me. On that screen you see in the back, that's where I pop up. And then together we take care of our patient. What's nice about this setting is I actually have access to all my tools, right? So I can ask my MA to serve as my hands, and then she will go ahead and do everything that I need to do. So I can look inside ears, nose, and throat. I can listen to heart and lungs. I have access to an EKG machine. I can do labs. I can do all my rapid strep test, flu test, all these different things, very similar to how you would in a regular urgent care. And then this is really a picture of me when I am in my clinic. And this is when I was doing a telemedicine visit with one of my patients. So this is a little bit of a different setup, but both telemedicine, both two-way live audiovisual synchronous connections. All right, so that was our first reimbursable category there. Next thing we're going to talk about are telephone and e-visits. And telephone and e-visits are specifically known as brief communication technology-based service or a virtual check-in. So we'll start with that first. And these are codes that were actually as of 2019, and it's most commonly used for telephone. So it can include, of course, audio, visual, and secure text messaging and email, but most commonly it's done, you utilize it when you're doing a phone visit. The patient has to initiate the service. There is no geographical restriction. So basically the patient can be at home. And these are, again, time-based codes. So they're roughly about 5 to 10 minutes, depending on the medical discussion that you're having with your patient. There are a few modifiers, specific ones that you do put in along with your place of service codes, and that these have to be done within, they have to be done outside of a particular range. So it can't be, for example, like you just saw the patient yesterday and then they call you about the same complaint and you bill it as a separate thing, because it doesn't work that way. It has to be within, it can't be within 7 days of an E&M visit if it was an in-person code. And now, because of the public health emergency, this can actually be a new patient. We can do it this way as well. So let's see our next patient together. So here we have Mr. Rudolph Reindeer, and we're going to go ahead and start. The conversation could go something like this. Hello, Mr. Reindeer. I received a message of your missed call. How can I help? And then Rudolph will say, I can't come in for a patient visit, in-person visit today. I've had these symptoms of sneezy, runny nose. My nose is red. I keep sneezing. I keep blowing my nose. I have watery, itchy eyes. Can you just treat me over the phone? I can't come in because I'm about to fly out. And so as the medical provider, I'd say, sure, we can do a telephone visit. I can help take care of your symptoms. And once I get a little bit more information, since we are taking care of a medical condition, I can make this a telephone encounter and we can bill it to your insurance. They'll cover that. Do I have your consent to start? And Rudolph can say, oh, great. Yeah, I'm happy. Go ahead. Go ahead. I'm happy to know that my insurance will cover this. You have my consent to start. So the conversation can go something like this now. So going back to before we talk about that, remember our chief complaint was sneezy, runny nose is red, keep sneezing, blowing my nose, I have watery, itchy eyes. And remember how I told you a little bit earlier that we're going to use the mnemonic tonight called old carts. And remember, this is what we're going to be looking for and asking, because telemedicine is just a platform. The medicine doesn't change. So we still follow it the same way that we would do a history. All right, so here we go. So here we have Mr. Rudolph Reindeer, who is a 37-year-old male pilot. What did you think he did? With no significant past medical history, who presents today via telephone encounter, complaining of allergic rhinitis symptoms for 1 day. He describes it as sneezy, runny nose with a clear discharge, erythematous pruritic eyes, and the symptoms started when he flew into Dallas. So basically all that means is, of course, he's having sneezy, runny nose, clear discharge, redness, and itchy eyes. That's what erythematous and pruritic eyes mean. And of course, like I said, his symptoms started when he flew into Dallas, and this was a new change of climate for him. He's tried saline rinse, over-the-counter airborne, over-the-counter clear eye drops, and all of them without much relief. No history of fevers, chills, nausea, vomiting, loss of taste or smell. He admits to similar symptoms in the past when he travels into new climates, and he's used Flonase before, which has really helped with the symptoms. Due to the current COVID-19 pandemic, he is required to do a COVID test before flying, and the results were negative. So you see, even in our history, we followed the same mnemonic that we learned about earlier with old carts, and we still got the same story. All right, so past medical history, if we ask him if he has anything, said no. Any surgical history? No. Any medications that he's currently taking? No. Any allergies? No known drug allergies, that's what that stands for. Social history, he doesn't smoke cigarettes, no alcohol use, no drugs. He works with American Airlines and he travels to new cities for work. So even on a telephone encounter, we can still do a physical exam. Now it's limited, but we can still comment on a few things. So vital signs, and patient reported that he has no fever. His temperature was 98.6. He happened to have a blood pressure cuff, so we can get that, 120/80, and a pulse of 80. We can still comment on things like respiration. He's able to speak in full sentences. His voice was of normal quality, no audible coughs or shortness of breath or sneezing noted. We can comment on his neuro exam, that his speech was of normal rate, volume, and articulation, and thought process was sequential and coherent. And we can even comment on the psychiatric portion, that he was cooperative in an appropriate situational mood. So even on a telephone encounter, we can still comment on a few items of a physical exam. And so we come up with our diagnosis, which is allergic rhinitis. And we can tell him to go ahead and use over-the-counter Claritin to help with the symptoms. We can refill his Flonase because he's used that in the past and he said it helped. And we tell him 1 puff in each nostril, and we can dispense 1. We give him 3 refills, and we can e-prescribe that into the pharmacy of his choice. We can follow up with him 1 week or sooner if symptoms are not improving. And of course, as always, we go over red flags and that we document that we reviewed it with him and he knows what to do and where to follow up in case anything happens. So in this situation, remember keeping in mind that our pilot, Mr. Rudolph Reindeer, he is definitely flying. So we want to make sure that when we tell him and we advise him to use something over the counter to help with the symptoms, that we keep that in mind. And so we would want to give him something non-sedating, which is why we went ahead and told him to use the Claritin. So keep that in mind. Remember, we're treating our patient, not just the symptoms. All right, the next thing is on telephone and e-visits is that second half known as email, and for email, which is known as online digital management and evaluation services, also known as e-visit. All right, so these were codes in 2020, and so these were actually done pre-COVID, these are defined as non-face-to-face online digital evaluation and management services. And these could include reviewing HIPAA compliant patient email, text messages, secure messaging. And again, patient initiates this. These are again, time-based codes typically. There are no geographic restrictions, so the patient can be at home. And these can't be used for things such as these cannot be used for things such as medication refills, appointment requests, or clarifying questions. These have to truly be a separate thing altogether. And now with the public health emergency, this can again also be a new patient. So they did make a little bit of leniency with that. All right, so this is probably the most common way that you've seen this been done, which is obviously utilizing an app. So just for the record, there is no PAVMT mobile app. I made it up, but why not, right? So this is kind of the symptoms or the questions that can pop up on these kinds of apps. And these are all asynchronously done, meaning these are going to be done via not in real time. So you, for example, if you were to open up an app right now of your choice and you would go ahead and fill out those questions, it doesn't mean that the provider is getting it immediately or is in a live two-way audiovisual synchronous connection. It could be that they, get it either 15 minutes later, an hour later, whatever it is. It's not a live interaction. So these are some of the questions that can typically pop up. And again, you'll notice that all of these questions follow the same mnemonic that we've been using tonight, which is old carts, right? So it's still, you'll notice there that it talks about your onset, location, duration, things that make it better, things that make it worse, and then how would you rate your pain? So it follows the same pattern because telemedicine is medicine. It's just a different platform, that's all. And so that's my little reminder that we are still utilizing the same history taking. All right, so here's our next patient for tonight we're going to be seeing asynchronously, and it's Mr. Santa Claus. And the reason for the request is a skin complaint. Patient requests for an asynchronous treatment without an office visit. Mr. Claus submitted the following information via our PAVMT mobile app. And he went ahead and selected our pharmacy, which is our PAVMT pharmacy located here on 1234 Make Believe Lane in Dallas, Texas, and the telephone number is listed there. So just like you saw, it prompted some questions. And the first one that came up is, how long have you had this? He went ahead and filled in about 2 days. On a scale of 1 to 10, how would you rate the pain? And he told us about a 3 out of 10. And then we asked him for a description of what happened. And this is kind of like a free text. So he went ahead and told us that he was delivering a package with a cup of coffee in his left hand. The resident owner's cat bumped his hand, and while he still had the coffee in it, and it spilled on him and on the floor. He was told to apply some butter on the burn, which could help, and it didn't. So now he has this blister that showed up today. He can still use his left hand as normal, except now he has this blister that is tender to touch. And it also prompts and asks when was his last tetanus vaccine. He told us is about a year ago, and it allows him to send some pictures of the injured area. So normally, I've seen that typically most platforms will ask for at least 3 pictures. In this case, I only had 2 because that's all I had space for this slide. The first one is what he sent, which is a picture of his hand. And the second one is a picture of a spilled coffee because when Santa spills coffee, magical things happen. All right, so we went ahead and come up with our diagnosis, which is a 2nd-degree burn with a blister. And we can go ahead and come up with a treatment and plan. So we can prescribe some silver celandine cream and we can tell the patient to apply it topically. We can remind him to keep the wound clean, covered, and dry. Remind him not to pop the blister. His last tetanus was about a year ago, so we're good because tetanus vaccines are usually good for about 10 years, or we recommend 5 years if it's any big injury wound, especially if it's a dirty wound or anything. And then red flags were reviewed with the patient, as we always do. We follow up with the patient in a few days to make sure that things are improving. So this one happened to be a second degree burn, but just so you know, they are different degrees of burns. So most commonly, most people know of first degree, second degree, and third degree burns. They are actually fourth degree burns as well. And then also being aware of the mechanism of injury, because there are different types of burns. So you could have a chemical burn, you could have a friction burn, you could have a freeze burn, thermal burn, radiation burn. So again, being mindful of what type of injury or how did the mechanism of injury occur is important in our medical decision-making as well. All right, moving on now to the next area, which is interprofessional consult, also known as curbside consults or e-consults. So that's what we're going to talk about next. And these are actually provider-initiated consults to another qualified health provider on behalf of the patient. So it's like sometimes known as doc-to-doc or a curbside consult. It doesn't actually require the patient. It's actually two medical providers who are talking to each other about the care of that patient. So these are codes as of 2019, and both the requesting and the consulting provider will each have their own codes that they get to bill, and both providers get paid. So documentation is required by both of the providers. There is no geographic restriction, and patient is not directly treated by the consulting provider. Usually they stay with the originating provider, and no change in the public health emergency. So you remember I told you that I work in an obesity medicine practice. So we're going to pretend that you are a primary care clinician and you are asking for an e-consult regarding the management of our earlier patient, Mr. Santa Claus, who is affected by obesity, specifically metabolic syndrome, but is unable to come see me, the specialist, because of a scheduling conflict. Now, it could be that my wait times are really long, so he's unable to come in to see me. Could be his scheduling conflict. It could be a whole bunch of different things, but either way, it's going to be now two providers. So both of us as medical providers are going to have a discussion about our patient here, Mr. Santa Claus. And we're going to be talking about metabolic syndrome. So metabolic syndrome is specifically defined as having at least 3 of these 5 components. So an elevated waist circumference, elevated triglycerides, low HDL, elevated blood pressure, and elevated fasting glucose of 100 or higher. And the reason it's important to be aware of metabolic syndrome is these are actually a cluster of symptoms that can make you at a higher risk for things like cardiovascular disease, diabetes, stroke. So this is things that in my day-to-day, what I usually deal with. In fact, the company that I work with, we went ahead and did a research paper, and we went ahead and actually published in the Journal of Public Health about this and how we were able to use our, do a medically supervised program for our patients to help with metabolic syndrome. So this is going to be essentially, you're going to send over this information about Mr. Santa Claus to me. I'm going to do a complete personal history, look over his family history, a nutritional history, physical activity history, history of weight promoting medications, blood work, imaging, and then I'll come up with a recommendation on medications to discharge if possible, come up with a nutrition plan, an exercise plan, behavioral modification, cognitive behavioral therapy, suggestions, and tell you some medications and come up with a plan on what you can do to help implement and help our patient here. Now, the patient will never actually come see me. They will stay in-house with you if you're a primary care physician in this situation, as a primary care clinician, rather, in this situation, or because if they actually come see me, then this actually you can't bill for this because then it just defeats the entire purpose of all of this. But they will actually stay with you, and I will actually never see the patient. So you will go ahead and implement these things and look at this amazing work that you've been able to do. So you have helped Mr. Santa Claus. He is looking great. He's doing a great job of losing weight and just helping with all of his comorbidities. And his metabolic syndrome is now getting much better than what it was before. All right, so let's talk about the last one here, which is remote patient monitoring and more. So remote patient monitoring and more, and we're going to talk also about artificial intelligence tonight. So our patient that we've been seeing all throughout tonight, Mr. Santa Claus, yeah, he's diabetic now. It was about to happen anyway. So this is kind of where we're at with him, and we can utilize something known as remote patient monitoring with him. So what will happen is it can be different ways. It could be kind of like a BYOD, bring your own device kind of a thing, where they can utilize whatever they have at home. It uploads into our portal, and then we can see the results on our end as medical providers, or we can provide them with the whole kit. So sometimes it'll come in a nice little suitcase looking thing, and it'll go ahead and provide, in this situation, like a glucometer, for example, and the strips and everything. So that way the patient can utilize that. And either way, it's going to upload the information into a portal so that we as medical providers can go ahead and review and monitor this patient. So what we want to do now is, you'll see here that at the bottom is an example of what a dashboard would look like. So it'll go ahead and have like the patient's name, the time. In this situation, we're monitoring him for his blood glucose, and then what's going to happen. So normally it'll usually be color coded, and it usually follows these traffic light colors. So you'll usually see it be kind of a green color as long as everything's good. So his one that he did at 8 p.m. looked great. It was at 89, no need to worry about it. Then about 1 p.m. the next day, we start to see that his blood sugars start creeping up a little bit. It gets about into the 150s. We will try to keep his blood sugar a little bit lower than that. And so what will happen is, usually it's a nurse or an MA who's monitoring this for us for the most part, and they will typically call and intervene at this time. So as long as it's in the yellow, there's typically a protocol in place, and they will call our patient Santa Claus and find out what happened. Why is your blood sugar level elevated? And it could be something very simple. He just forgot to take his medication or whatever it was. In this situation, that's what we're going to say he did. So the nurse reminds him, and then that takes care of that. But then we start to notice that his blood sugars get even higher. So again, around 8 a.m. the next day, it's at 250, and that's way too high than what we want him to be as a fasting blood sugar. So what will happen is, it'll call us as medical providers. We'll get a phone call, and we'll have to kind of do a medical intervention. So that's when typically we get involved, and we can see that it'll color code it red, and then we tell them, hey, this is what I want you to do. So either increase your insulin, or have you come in, or whatever it is that we're going to do as far as for our patient, and go from there. So in this situation, we're going to advise him to increase his insulin. So fun fact, I also do beta testing for various companies, specifically now with their wearable devices and different medical apps and things like that. So this was one that I did earlier this year. Every now and then I get published. So this one was in particular with a device that can be used for fertility monitoring tracking. And it is something that would be of use or benefit to me that I could use with my patients who are, for example, trying to conceive, who are struggling with infertility, or even my patients who are dealing with things like PCOS. So where they're having anovulatory cycles, this would be something that I could use to help better track and gather information, again, using this remote patient monitoring. All right, moving on, let's talk next about artificial intelligence. It can be defined as a branch of computer science dealing with the simulation of intelligent human behavior and computers. So this could be things like speech recognition and visual perception. You actually use this all the time, you just may not realize that you're using it. So for example, when you ask Alexa to do something for you, you're using AI. When Facebook tags your pictures, you're using AI. It's essentially done by creating an algorithm that can solve problems. So this is in medicine, it's taken a large position, specifically in dermatology, because of its large clinical and dermoscopical and dermapathological database. So there is a lot of jargon that's associated with machine learning, but know that one of them is known as deep learning. So deep learning is usually when the machine is looking at multiple layers of a convolutional neural network, and it doesn't require explicit feature definition. So I know that sounds like a lot of words and a lot of jargon, but basically it's a computer that can learn. So in a very oversimplification, this is kind of how Netflix knows and suggests what you should watch next. So as of September of 2018, the FDA has approved AI to identify signs of diabetic retinopathy in retinal images, recognize signs of a stroke in CT scans, visualize blood flow to the heart, and detect skin cancer from clinical images captured using a mobile app. So this is also something that I work on, or that I do. So this here is a picture of how we utilize and capture using autonomous AI to look in the back of a patient's eye to screen for something like diabetic retinopathy. So I shared with you earlier, I am physically in Dallas, Texas. My patient is in Delaware. And using artificial intelligence, I can look in the back of their eye. So this is how the machine kind of looks. And basically there's an MA or an operator there who would go ahead and get the patient set up. And this particular machine is autonomous, meaning it kind of does it by itself. And then what it'll do is it'll go ahead and scan the back of the eye, it'll capture the picture and then send over a report to me. I get the report, I hop onto the platform, we review it with our patient, and then make recommendations accordingly. If it's something that requires more emergent referral out to higher level care, or if it's something that it's going exactly the way that we predict, but we're using AI to go ahead and take care of our patients that way. All right. So that is all of our different overall kind of a brief overview of the different types of telemedicine. So I hope you got to see that it's more than just a two-way live audiovisual synchronous connection. So that's what most people think of when you say telemedicine, right? So it's something like this, but there are actually other types, and it's stuff that we can definitely utilize. And going back to the second poll question that I asked you, on if you feel like this is something that you will utilize in your career and your future careers, then yeah, probably. So I think it's here to stay. And in some way, shape, or form, you may end up using telemedicine. And I see it being integrated in so many various different specialties in different ways, especially utilizing the different types that we kind of talked about today. All right, so since this is supposed to be a shadowing experience, I thought you would like to see a patient with me. So I have this up for you where you can actually watch me do a telemedicine visit. So it'll be with the chief complaint of a right shoulder pain for 4 weeks. And if you click on it, you'll actually be able to watch the entire presentation. I'm just gonna fast forward through because I'm not gonna show you.
So you're gonna experience some shoulder pain on your right side. Yes. Did the pain come on quickly or was it more gradual?
So you'll see how I go through a history, the same cold era stuff that we talked about, or not cold era, old carts, excuse me, that we talked about earlier, the same mnemonic that we use to capture our history. You'll see me go through that as well. And then what's fun about this case is, oh, hold on, let me see if I can move it. That we went ahead and created it as a choose your own adventure style simulation. So what will actually happen is as you go through it, it'll stop at certain key points, and it'll ask you to choose what I should do next. So depending on what you choose, either I'll say the right answer or I'll say something completely silly. So go ahead, and I went ahead and put the link at the bottom along with the QR code. Well, you're welcome to take a screenshot of this and then visit it a little bit later. So that way you get a chance to see, and actually you get a chance to run the case as a telemedicine provider. And then I thought we could go ahead and open up the floor for Q&A. But before we do that, I thought I'd share a few words of wisdom with you. So you are about to embark into a field of taking care of patients, and there tends to be a high chance of provider or caregiver burnout. So while it is absolutely noble and wonderful, and kudos for you for going into this field of medicine, whatever avenue that is, whether it's PA, MD, doctor, NP, whatever, OT, PT, there's so many different variations. They're all wonderful, and they each have their own strengths, and they're absolutely a vital part of the medical caregiving team. It is important to protect your time, right? So oftentimes that means saying no to things. So because you are giving so much into this, you say no to, no, I can't go to this party because I have to study. No, I can't do this. But what I want to remind you is, remember to also say yes to things. Say yes to things that make you happy. And so that's going to be really important so that you don't burn out, because as wonderful and noble as it is that you are going into this field, provider burnout is real. And I'm just reminding you to take care of yourself too. You have to fill your cup before you can serve to others. Your education does not stop after school ends or your training ends. So I encourage you to be lifelong learners and fall in love with learning. And then we'll go ahead and open the floor up for Q&A if you'd like.
Okay, sounds good. Thank you so much for that presentation and those examples. That was definitely a really good image of telemedicine that I personally have never seen before, that side of it. So that was super cool.
Good. I hoped it was at least entertaining to keep your attention as you guys came in to view this in the evening.
So I'll start just reading off some of the ones that have been rolling in through the session. So we had a question earlier that someone asked, what if the patient doesn't have any medical machines or even a thermometer? How will you get the patient health info that is needed? Also, do you guys give them any free kit or items to help with that? I think that's what they're asking.
Yeah, that was a great question. So you're right. Sometimes a patient may not have something at home, and that's okay. When you're doing a telemedicine, again, depending on what you're doing it for, right? So there are times where telemedicine is not an appropriate platform. So depending on what it is, we're assuming that this is an appropriate platform for what you're doing. So like our patient that we saw earlier today, Mr. Santa Claus, with our symptoms of GERD, even if you didn't have a thermometer or a temperature for him, okay, no, not a big deal. We can still go through, we can still do our visual assessment, and we can still see that this patient is stable and safe and still get the information we may need to go ahead and take care of that. Now, if I find out that this patient has a history of high blood pressure, well, then I may strongly advise him, yeah, I need you to have a blood pressure cuff, or we're going to go ahead and at minimum do a pulse count. At minimum, I can always count respirations. Those are things that you may not even need any other tools. And that may give me enough information, assuming that this is an appropriate thing of what we're taking care of via telemedicine, that I can still gather the information I need and take care of that way. The second part of your question where you asked about, do we provide kits? Yeah, sometimes we do. So oftentimes, especially in remote patient monitoring, that's when typically those kits go out. But sometimes depending on what you're treating them for, then you can definitely either provide them with a kit, or you can ask them to have certain tools available if they know that this is something that's ongoing.
Cool. Okay, sounds good. I didn't know that's cool about being able to give them a little kit.
Yeah, it's actually really interesting looking, especially if you do the remote patient monitoring ones. You'll see it a lot, oftentimes in people who are doing like, what's it called? Like your clinical trials. That's where you see it. It literally looks like a suitcase. You kind of look like a spy. You have this little kit that you get to take.
Perfect. Okay, next, someone asked, how did you arrive at telemedicine, especially since you started practicing before the pandemic? And how were you initially exposed to this field, or maybe when?
Okay, so my story is a little bit unusual. I will do my best to sum it up really quick for you. So back in 2018, so pre-pandemic, I was working in a small town. So I wasn't in a big city like Dallas, Texas, like I am now. At that time, I was working for an occupational health clinic. And this clinic was run by essentially a nurse practitioner and myself. And because it was in a smaller town, it was really hard for us to find a doctor who would want to come and live there and become the medical director. So we often had locums doctors or doctors who would come visit, but none of them actually ever stayed there. The two providers that pretty much ran the clinic was myself and this nurse practitioner. But the dream team was supposed to be one doctor, a nurse practitioner, and a PA. That's what we were supposed to be. So then finally, we got two doctors who were interested and came and interviewed for the position of a medical director. We were so excited, they were great, and the company went ahead and offered the position of medical director to both of them, thinking that, okay, hopefully at least one of them will go ahead and accept the position. Except both of them accepted the position. So what ended up happening is the company made a decision to dissolve my position and the nurse practitioner's position to fund the second doctor's salary. It was a business decision, no hard feelings. But what was not cool is that they didn't tell us. So we went from one day having a job to the next day not having one. So because I was living in a small town at this time, it was really hard to find another PA job. So what I ended up doing is doing what I used to do before PA school, which is I used to be a teacher. So that was actually my first exposure to the virtual space, because I started up as a teacher for a completely online virtual school, which pre-pandemic was revolutionary. That was just not happening pre-pandemic. But that was my first exposure to the virtual space, where I got a chance to see how this company would take teachers and make them into effective online virtual teachers, and how we can connect with our students, and how we had an online database of all of the information we may need, and how to connect with our patients and our parents and our students. And that was the first time I actually got exposed to that. Then during that time, because I wasn't working as a PA, what ended up happening is I saw a position for a startup company. And this startup company was doing, like I showed you, this virtual urgent care. And I went ahead and applied. I got the position. And so I started off as a provider in that aspect. And because it was a startup company at that time, I went ahead and shared my experience, which was, hey, this is what happened. This is what I did. I've seen how they do it in teaching. And they liked that. And so they invited me to be part of their management side. So I became on the management side as well. So now I had a unique perspective, because I got to see what it was like to be a provider and what it was like to be on the management side of things. So that's when I started to reach out to my colleagues to ask for help and advice, because I was like, okay, I'm still learning this and I don't know what exactly to do. So I reached out to the people at PAVMT, which is PAs for Virtual Medicine and Telemedicine. And these are my colleagues. And I said, look, help me. What are you guys doing? They've been practicing in the virtual space longer than I had. And how do you, go through all these challenges and hoops, both legislative and from the management side, as well as how to do things on a virtual platform. And so I connected with them, and at that time, PAVMT was joining. When PAVMT started, they asked me to be part of their board with them, and I was so scared. I literally felt like the dumbest person in the room, but that is exactly the room you want to be in. And so when I joined that, I started off as secretary because I figured the least I could do was take good notes. I was in PA school. I knew how to take good notes. And then fast forward, now I'm your vice president for PAs in Virtual Medicine and Telemedicine. So I know, sorry, long answer to your question, but that is my journey of telemedicine. And now I get a chance to teach PA students about it and get it integrated into the medical curriculum. Sorry.
No, I think that was perfect. No, my specialty is rambling on about stories. So you summarized that perfectly. And that's definitely quite the path to find your way there, but definitely all worth it and very interesting and pretty revolutionary in a time like this. Continuing on with another question that's kind of on the theme of that. Alyssa asked, what do you think are the benefits and also challenges of working in telehealth versus a more, quote, traditional healthcare setting?
Great question, Alyssa. So the benefit of telemedicine, I'm going to give you two benefits. One is that you can meet the patient wherever they're at, right? So they no longer have to, for example, take time off of their work to come in to see me. Maybe if they're, let's say, a single parent, they have to now take off of work. They have to arrange for childcare. They've got to come see me. They've got to park in the, pay for parking. I mean, it's a whole ordeal for something that may or may not necessarily require an actual in-person visit. So it's convenience. It's about meeting my patients where they're at. I no longer am limited to zip codes. I can now practice, like I shared with you, I'm in Dallas, Texas. My patients are in Delaware. I am nowhere close to them. So it allows us to be a little bit more access to care, right? So it helps with that. The other thing of my other job, which is obesity medicine, it allows me also to capture those visits. So inevitably in a day, when I have, let's say, a panel of 20 patients that I'm seeing in a day, somebody is going to cancel. It's just what happens, right? There's going to be a no-show, they can't come in, whatever it is. But what I can also do is, because I have the platform of telemedicine, I can usually call and ask them, hey, can we just do a telemedicine visit? And they're usually like, oh yeah, no problem. So I'm still able to capture that visit and help take care of them and help them on their journey to wellness. So it kind of negates all those other little extra things that may come in and hinder them. So those are the pros. The cons of telemedicine is, obviously, you're not there in person. So is it a little bit harder? Sure, it is. Do you have to sometimes be creative and think outside the box to get your answers? Absolutely. And are there times where telemedicine is not the appropriate platform? Absolutely. So I'm not saying it's your solution to all problems in life. I'm just saying it is a platform, a way to connect with our patients to hopefully help them on their journey for whatever it is.
Yeah, perfect. That makes total sense. And along with that, Elsa asked, are there any barriers to telemedicine that you have seen in practice? And maybe you've already said everything as the disadvantages that you listed, but Elsa also added, especially for patients in areas or in situations of a lower socioeconomic status.
Absolutely. So barriers twofold. One, exactly what you brought up, which is that lower socioeconomic status or inability to have access to care. So think about, for example, our homeless population, right? I mean, they may not even have access to a computer or a laptop or something like that to access telemedicine. So going back to what we talked about a little bit earlier, that suitcase I was telling you about, that we can do like remote patient monitoring, there is actually, if you go to our PAVMT website, sorry, I have to put a plug in here. There is actually an interview I did with a provider who that's what she does. Her patient population is the homeless population. And she actually has a hardware device that she takes out into the field to help take care of her patients. So she's still using remote patient monitoring and using our telemedicine, but she is actually taking the device out to them and then using that to connect with other providers to help better take care of them. So that is something that, even though it's a challenge, can be used as a pro thing, but obviously also connectivity issues are sometimes, you may not have access to internet. So that's when we start utilizing things like cellular or satellite data, but even then it's not foolproof. I mean, there are times where it's still a challenge and we still can't connect with everyone. Legislatively, there's also a huge challenge with telemedicine, especially as a PA I'm speaking of, because remember, you must be licensed in the state where the patient is located. So unless I happen to have a license where my patient is, I can't see them. So there are compacts that are in place. So doctors have the ability to have medical compacts, nurses have the ability to have that. PAs are also trying to get that. We keep in touch with FSMB, which is Federation of State Medical Board, to hopefully get that. We received a grant, so hopefully that will be coming down the pipeline.
Great. Thank you for that answer. So kind of shifting over to your career as a PA, where Siri asked, how did you obtain your patient care hours before applying to PA school? So throwing it back a little bit.
This is why I so love talking to you guys, but sometimes I feel like I don't know if I'm much help, because it's been a hot minute since I've been in your position. So of course, what I did pre-PA school is I did shadow a PA. I did a lot of shadowing hours. I shadowed all different specialties, but especially a PA. And we had to have, I don't even remember how many hours it was, because I graduated from Baylor in 2009. So, I mean, that's like even way before that. So it's, oh my gosh, I'm trying to think here. I don't even remember how many hours it was, but I remember shadowing definitely doctors and hospitals and all the stuff. And then I specifically did a PA because that was kind of my aha moment for me, as far as why I wanted to go into the PA route.
And adding on to that, no, that's totally fine. And adding on to that, did you have any time that you chose PA over MD or DO or another career in medicine? And what kind of made you shift that way?
Yeah, I always knew I wanted to do medicine. Like that was always kind of my calling. I had no idea what a PA was until I was in college. I think that's when my first exposure to what even a PA was. I just always thought it was doctor, nurse, like those were kind of just what I grew up knowing or what I was exposed to. And then I started shadowing a PA, and she was my mentor. I still keep in touch with her today. She was an OBGYN. And that was when it was kind of like my moment, because I got a chance to see, here was a PA who was a very vital part of the medical team. She had her own patient panel. She was able to really spend time with her patients, really educate her patients, and make a change and make a decision, make medical decisions that helped her patients. But what really I loved about it is that at the same time, it gave her an opportunity and time to do something more than medicine, right? So like when she was done, and she was able to do other things that were pursue her passions and different things like that. So I like that balance. I like the ability that as a PA, we're trained as generalist. So we have that lateral movement ability. So I shared with you already in the story, that previously I used to work in occupational health. Then I work currently right now in obesity medicine. I work in virtual urgent care because I have the ability to move different specialties, right? I'm not just stopping at one. And so that gives me the flexibility to, as my life changes, as different things happen, my job is able to keep up with me, if that makes any sense.
Of course, yeah. And I know for me, since I don't know how many of our participants today, I think we probably have a lot of hopefully future PAs on here since it's a PA shadowing session, but that's definitely something that resonates with me because I've been in that same boat, thinking about PA over other careers, and I totally had like this summer, the same part of the same realization of many of those benefits. And yeah, that just made a lot of sense. And that's a good insight on that. Mm-hmm. I'll just do a few more since we're almost to the end of our time here, unfortunately. But another question about background and information about PA school. Myra asked, what was your undergraduate degree in, and does it have to be related to sciences and medicine? So I'm assuming Myra wants to also maybe go into PA or medicine.
Sure, absolutely. And I think actually you can answer this for both. So it doesn't have to be, is basically what I was going to say, that it doesn't have to be science related. So I graduated with my bachelor's in public health, which ironically falls under the College of Education in the university that I was in. So that's how I was able to double dip and get my educational degree as well, because that was my backup. If I didn't get into PA school, I was going to go into teaching, which ended up being helpful because I told you when I lost my job, that's what I fell back into. And so that was my background. My minor was in mathematics and science. So it's helpful if you, in the sense of if you're in the sciences, just because you're going to have so many things that are prerequisites that you have to submit in before you're able to do it. But you by no means have to. You can do other things. In fact, a lot of times they like it when you do other things because you're able to bring a different perspective, and you can utilize that as your strength.
Cool. Okay. And then Dim asked, I don't know if you have any insight on this, but I thought I'd throw it out there. I'm an international student hoping to get into PA school. Do you have any advice you could give me?
Like I said, it has been a hot minute since I've tried to get into PA school. So I know so much has changed. But I mean, I think the basics are still there, right? Like you still have to do your prerequisites. You still have to do your different entrance exams. So back when I was, which God, I'm prehistoric now. I had to do my GRE and MCATs, but now there's a PA CAT, which I have absolutely no idea what that looks like. I assume it's similar to MCATs, but I have no idea. So, see what the requirements are. But I would say your place to really shine is especially in your personal statements, and use your story. Everybody has a story. Everybody has a strength. And so use what you've been exposed to, what you've seen, what you've done, and how you plan to utilize that in a positive way. So in that long wound out story that I told you about how I lost my job and all that stuff. But now I look back, you know what? Thank God I lost my job. Thank goodness I did, because I wouldn't be where I am right now if that hadn't happened. I had a good thing going. I was working, had a great team. I was enjoying what I was doing at that time, but life throws you curveballs. And when life gives you, with different adversities comes different opportunities, and use that as your strength. That's what I would say.
Perfect. And then I think maybe just two more. Sure. Andrea asked, for PAs, what role, if any, does the supervising physician play in telemedicine?
Sure. So your collaborating physician, again, similar to how they would be in person, which can vary. And it's also state dependent, right? So each state dictates what those supervision hours or collaborative hours look like. So in both of my practices, my obesity medicine practice, if you actually came to my practice, you would never see the doctor, because my doctor actually is never even there. So he's always available to me via phone, via whatever. I can always get a hold of him to, ask for help, but you would never see him. There's a picture of him in the lobby, but that's about all you know of him. And so that one, like I said, it's collaborative, but I work very autonomously, very independently. With my virtual urgent care, same thing, we're literally states apart. So I never actually see him, but same thing, he's always available. I can always call him and connect with him. And then also when I'm on, when I'm on call or my shift is on, there's usually other providers on there too. So we can usually collaborate and talk that way too, if needed. So that's how we usually do it.
Cool, sounds good. And if you could pick any, what is your favorite part about your job?
I really enjoy, as far as telemedicine, because I figured that's what you're asking since that was our tonight's topic. What I really enjoy about telemedicine is it really allows me to think outside the box. And what I mean by that is there's certain information that I'm trying to get, right? But how I get that information, sometimes I have to think a little bit creatively to get that information. And it really forces me to be aware and to be observant of everything that's going around. And it also forces me to really be mindful of what I'm asking and why I'm asking. So, I didn't bring my little demo kit with me. If you give me a minute, I'll go grab it. 1 second. All right, sorry about that, guys. All right, so here is the example that I share with the students that you guys are welcome to see. So we're gonna pretend that I am seeing a patient for a rash. So here's my rash, right? We're gonna pretend that I have this rash on my hand. So I wanna know, as a medical provider, does this rash blanch or not? What that means is if I press on it, does it fade or does it stay there? Because that changes what I'm dealing with here. If it's something that doesn't fade or go away, that usually means it's a ruptured capillary, a ruptured something, and that changes all difference of what I'm doing, versus if it's something like a hive or something that is blanchable. So I can ask the patient, hey, can you push on that rash and tell me, does it go away or not? But sometimes that's a little bit hard. So what I can ask the patient to do is to utilize something like a plastic glass or a cup. Most patients have something like this at home, right? So what you do is you ask the patient, okay, here's your rash, hold it up to the screen, take your cup and push on it. And now what I can do is I can visually see through the clear glass, does the rash blanch or not? And then it forces me to utilize common things, but think outside the box so I can get the information I need and also do it objectively. Because if a patient came in to see me in the clinic, I would do it, I would do my exam, right? It's an objective finding versus sometimes on telemedicine, it's a subjective finding, meaning the patient is reporting it, but physical exam components, you usually want them to be objective. So that's a little tip and trick. I show that with my PA students, so I thought you might enjoy that.
Yeah, definitely. That was a good visual for that. And it really brought to mind, I'm sure I know I've heard, but as pre-health students, we always hear about critical thinking, but that definitely puts that into practice and gives a really good example of that. And I think we're out of time and it's time to wrap up for today, but I just want to say on behalf of everyone today, thank you so much for coming to speak to us. I think it was a really informative session and definitely gave us more of an insight into telemedicine, which is, I know personally, is something I haven't had as much exposure to, but it's definitely going to be something that's probably a part of our future. So thank you so much for speaking today, and we all appreciate it.
Oh, my pleasure. Thank you all for coming on. I know you guys have, like you said, finals and everything going on, so I appreciate you coming and allowing me to talk to you all a little bit about this and being kind.
Of course. Us, if you students and our viewers, if everyone will stick around, I have a wrap-up presentation, but you're welcome to log off whenever you feel you're good to go. And thank you so much again.
Sure thing. Have a wonderful evening, everyone. And for those of you who are getting ready to take your exams, best of luck. You can do this. And after it's all over, remember to say yes to something that makes you happy. Take care, everyone. Bye.
Bye. Okay. All right, everyone. I'm just going to share our wrap-up presentation quickly, and then we will be done with this session for tonight. So let me share my screen again. Okay. So thank you so much to everyone for coming today. And I know I learned a lot, so I hope everyone else learned a lot today as well. Considering this, we would like to encourage everyone to reflect on the session today. What brought you to the session? What are 3 major takeaways you got? And what do you want to learn more about? This writing reflection is not required. However, we encourage you to submit it to our website for publication for recognition of all your hard work and to enhance future applications. If you would like some recognition, once again, we would like you to share your thoughts on today's session or share your thoughts on any article, reflection, review, or success story at this link. Once again, I just want to remind everyone that we are launching a research program that will allow students to connect with PIs as they conduct research in a plethora of topics, fields, and locations. This is 100% remote, which means you have the power to connect with anyone from anywhere, and this is an 8-week program. For more information, please fill out the interest form sent in the chat below, and we will get back to you as soon as possible with additional details. Furthermore, we are hosting a bingo board social media event for this year, where you will be able to fill up a bingo board with each board having a specified dollar amount. To participate, all you need to do is post this on your social media platforms and get a group of friends to help you fill out the board. And once again, we have partnered with Krispy Kreme, and with a donation of $10, you'll be able to receive a full dozen donuts while also helping us at PHS. For more info instructions, You can check out the link sent in the chat or check out our highlights on our Instagram. It's always the perfect time to exercise outdoors or indoors with PHS's new Pledge Drive event. For this event, you will essentially be able to work out and help raise money for an excellent and healthy cause. For every $5 donated to you, you will be required to exercise for 1 hour. For more information, please visit our website underneath the blog section. And if you'd like to get more involved at PHS, we encourage you to visit our website and apply. You can become an asynchronous volunteer to get certified hours through professional nominations, graphic design, and social media promotion. And we are also accepting team member applications if you want to take on a more active role in PHS to lead projects and initiatives and to be up here with us. Once again, we are humbly asking that if you're financially able to donate, and if you could please consider sending a few dollars to us via Venmo or PayPal. It costs a lot to keep our program up and running and free to all of our students. So if you or someone you know can afford to donate, please support those who cannot by donating to our organization so everyone can continue to get the education they deserve. Otherwise, we simply ask that you just spread the word about PHS to reach as many possible students. Now for the part everyone's been waiting for, earning a digital certificate for the virtual shadowing hours from today's session. You first can go on our website at prehealthshadowing.com and find our professionals course pages. Next, you can take our quiz, which is a 10-question multiple choice quiz based on the content from the session today. You have 30 minutes per attempt to earn 70% or higher to get your certificate. We know sometimes technology can be difficult, and for this reason, allow 2 attempts to take the assessment. But if you run into any more difficulties, please contact us. To ensure that our website does not crash from a high influx of students, we recommend waiting about 30 minutes to an hour after the session to take the quiz, which will be open after the session indefinitely. Once you have passed, you can click the Finish Course button at the bottom of the Professionals page and download your certificate, verifying your virtual shadowing hours. If you missed a part of today's session, or if you want to go back and review or watch other sessions to earn more certificates with verified virtual shadowing hours, you can go to our YouTube channel and watch our previous recordings. You can also find them via the professional pages on our website and take the post-shadowing assessments for them as well. Be sure to follow us on social media or subscribe to our email list for the latest updates on upcoming sessions and events. And thank you for joining us today. And go ahead and stick around if you have any questions for us, myself and our other team members, and we will be sure to help you out. Other than that, the shadowing session is officially over, and I invite you all to log off, and I hope you have a wonderful rest of your evening. Thanks again.